A patient is scheduled for a minor procedure in the clinic. What is the medical assistant's role in the informed consent process? So we're focusing on what the medical assistant's role is, and the informed consent process is ensuring that the patient has agreed to the procedure while given the correct information to understand what they're agreeing to. So option A states, ensure the provider has obtained informed consent before proceeding. And yeah, that's very important because we can't proceed with the procedure unless the informed consent is completed, and it's ensuring that the responsibility is on the provider, who is the person who obtains this informed consent. So we'll go with option A. Let's look at the other choices though. Option B states to obtain the patient's informed consent on behalf of the provider, and no, this is incorrect because the provider is the one who is performing the informed consent. Option C states inform the patient about all potential complications of the procedure. Although this is very important, this must come from the provider and the one providing the surgery, not from the medical assistant. And then option C states allow the patient to sign consent form without reviewing its contents, and this would not be correct, not just because it's done by the medical assistant, but also because the patient needs to understand the content of what they're signing before they sign. So we'll eliminate D as well. And that leaves us with option A, ensure the provider has obtained informed consent before proceeding.